It is staggering that for every 10,000 people in India, we only have 8.6 doctors. This is because India has a very poor ratio of medical workers to people due to insufficient infrastructure and education in rural areas. Why is this a problem? Well, we see that accredited social health activists or ASHA workers are government-supported traveling medical workers targeted within these rural areas themselves, but they currently lack crucial technological support to meet their objectives, as they currently are operating with 5,000 people per worker when they'd like to be at 1,000 people per worker. This can be partly attributed due to a lack of digital medical records, which is something that our team is aiming to solve. We present our B2B business application, which will have digitized medical records, which will use computer vision-based handwriting recognition, and voice recognition to speed up this efficiency. Patient severity categorization to improve crowd control and reduce swarming around the workers. We will have a preliminary diagnostic tool using machine learning to create a knowledge graph that can speed up the ASHA worker's initial diagnosis and simultaneously record symptoms into the digitized record. Finally, we will have a medical information repository, which can be used to upskill and train the ASHA workers. So what is our value creation? We are shifting the point of care so that instead of walking 30 kilometers to the nearest hospital, rural patients can now rely on the traveling ASHA workers for better preliminary care. We're improving the quality of care through upskilling systems. We will be improving operational efficiency through our crowd control categorization system and our digitized handwritten record system, which should improve input efficiency back to 40%. We're also accessing an unserved market, and big data from this can be crucial for our business partners. Who are they, you might ask? Our target market is working with the government and NGOs as primary logistical partners, and insurance companies, pharmaceutical companies, and telecom industry companies for monetizing the big data collection aspect of our system. So moving on, we see our action plan is to establish a contractual relationship by 2022, improve a relationship with insurance, pharmaceutical, and telecom companies by 2023, and 2025, we aim to expand to all India operations. How does this help the UN SDGs? We are directly improving access to healthcare through logistical efficiencies and quality of care for rural healthcare networks, which is in line with the SDG 3. We also see our team. So I'm Indian and I have a business policy and strategy background. Amardeep comes with an app development background. Vaibhavi brings medical and machine learning. Akafor brings engineering and project management. Anawara brings medical and molecular biology. And finally, Jay brings supply chain management. So we are Asha Ki Asha, and we thank you for your time and your consideration.